First of all, thank you so much to you for organizing all of this. You have no idea what this is doing for me professionally and personally. This is a topic that I'm like super psyched about. So, a little bit about me. I am an occupational therapist. I have been practicing for almost 2 years now. I work at a level 1 trauma center for West Virginia University Medicine. So it's the largest hospital that we have in our hospital system across several different states in West Virginia, Maryland, places like that. So, and I'm also in school through Towson University to get my post-professional doctorate degree. So right now I'm doing my capstone project, and this whole interest for me in postpartum care and OT kind of started really when I first started working at my job. I was on orientation in August of 2021. So it was still, COVID was still pretty bad. Delta had just kind of started making its rounds, and we were having a large influx of pregnant patients that were coming in with COVID and needing emergent C-sections. So I was on my orientation through all of this in the cardiac ICU, seeing C-section moms who had delivered very early on ECMO and just still like crushing it, doing all the things. And I was like, holy moly, like this is, first of all, this is amazing. And then I was, still seeing them, seeing other patients. And I was like, wait, why are we not doing like newborn care things or things that they're going to have to do at home relating to caring for themselves or their newborn? But again, I'd only been working for a couple weeks at this point. So I was like, we'll figure it out as we go. And then, fortunately, COVID got better. Those patients, we don't have as many of those anymore. But from very early on, about 2 years ago, is when this seed kind of got planted into my head. So I started going through school, going through the courses, and the topic of what do you want to do for your capstone kind of came up. And I was like, well, I really want to do something, with like COVID patients and these pregnant moms that are coming in. And, like there's so much trauma, and I feel like opportunity for us to really invest our services in them. But fortunately, there were not as many COVID pregnant patients anymore. So I was working on another project for school, something that I wasn't like super interested in, and just made like, if the idea popped back into my head, made a random Facebook post. For those of you on Facebook who have had C-sections, do you think you would have benefited from talking with an OT prior to leaving the hospital about how to care for yourself, how to care for your newborn, how to move, how to get out of bed? Just curious. Didn't really think anything of it. And a couple hours later, there were like so many people that commented and were like, yes. Like my Facebook friends kind of know like what OT is because of just me posting things. And then people started messaging me saying I had trouble with this. Like if it wasn't for my partner, like I would have struggled so much and I needed all this help. And I had so much pain and swelling, and I wish someone would have talked to me before I left the hospital. I felt like I was just given a baby and sent home. So I was like, okay, I guess there's an opportunity here for this. So my advisor for my project is actually on here, Dr. Kendra Heat-Welshank. So she's like in the ringer with me with this right now. So we've been working together all summer. I took the ERAD course kind of like late or early summer, finishing it up, and it's been fantastic. I have nothing but great things to say about it. Giving me such a foundation and like such a fire in my soul for what I want to do. So as of right now, I have met with one of the main physicians in labor and delivery at my hospital, explained to her what I want to do. And what I want to do, long story short, is at our hospital, we have different teams of populations we see: cardiac, neuro, ortho, trauma, oncology, pediatrics, so on and so forth. What I want to do is I want a birthing center team. I want a labor and delivery team. I want it to be a regular protocol so that any woman who gives birth in the hospital is seen by PT and OT postpartum day 1, regardless of how you gave birth. So I've met with one of the main physicians at our hospital, and she's super excited about it. She even said, I asked an outpatient pelvic floor PT about this when I first started here years ago, but they said because they were outpatient, it would basically be like pro bono for the inpatient side. And she said, so truthfully, I never thought about it. And I'm embarrassed to say I never considered OT to service this role as well. I was like, well, it's nothing to be embarrassed about, but that is our job. And if you don't know what we do or what we're here for, then, why would you? So talking with her, and I am doing a grand rounds presentation with our OB department in November.
Marley, congratulations. That's huge.
Thank you. So in conclusion, I would love, my goal with all of this is to just hear from anyone here about like what you think OT could do to help you after your birth experience. If you're a therapist, what are you doing? What are your key interventions, education points? Like, I just want to know all the things.
I wanted to bring you back up and thank you so much for being here to share your story, because not only did you have an unexpected C-section for your first birth, you knew for sure you did not want another one. You did not want another cesarean delivery. So to answer Marley's question, can you just share a little bit about your birth experience?
Sure. Well, kind of picking it up right from there. And thanks for having me, and thank you for the opportunity to share with other practitioners, and hopefully this will change the face of the experience, at least inside of the traditional medical association. But I just had a vivid memory, I think, of the C-section, of the rushed nature in terms of coming to that decision, of not really knowing what recovery was going to be for that, and then having the memory of recovery and many challenges that happened over that time, and being a single parent, and being largely responsible for what at that point was my first child. I just didn't know how I would have done all of that again with two children and a C-section. So I went into this very clear that I didn't want to have another C-section. That firmness definitely waned a few times right through the whole experience, but I think it was really the driving factor in me coming back to saying, okay, no, this is really what I want to have happen. But it was a challenge. It wasn't an easy road, to say the least.
I was involved somewhat, but I have to really give kudos to Dr. Catherine Sylvester, who, between the both of us, we heard things that we'd never heard before. Your placenta at one point was deemed to be dried up. That was the terminology used. And so, Marley, I'm kind of talking to Pam, just as a healthcare provider, being in that experience with someone that is not a healthcare provider, and this is what she was being told. So Pam, I'll let you continue kind of pick up the story, if you will. But at one point you were told you need a C-section because your placenta has dried up. There's no more water left for your baby.
No more water. Yeah. That was actually what got me checked into the hospital after already being a week past due. And so when they said I had just coming back from like a 1.5 mile walk, and it was feeling good, and hadn't eaten since the morning, and I had been going back for basically monitoring every couple of days, because again, I didn't want to get checked in, but I did agree to just letting them keep monitoring me, make sure everything was okay. And that last time the doctor said, it looks like there's no water left. Anything could happen. You need to come right now. And I hadn't brought my bags. I hadn't planned on checking in that day, but it scared me. It definitely scared me, to say, okay, well, if there's no water, like, does that mean my baby's dying? Like, what does that mean? There's no water. They asked me if my water had broke by then. I didn't think so. I think I thought I would know if that occurred. But yeah, I had to settle some things. So I still was able to go home, even after they told me at that moment. But I did tell them after I got, some things in order, have my son settled, that I will come back. And I didn't know that was the beginning of all of the threatening language, not the end. I was told things like, you have to, the main thing I was told was that you have to watch out for shoulder dystocia because the baby looks like he's going to be too big. And he hadn't measured more than, I think, 7 or, what is it, centimeters, right? Or what is it? I don't even know how you quantify that, inches or whatever. But by the time they were really trying to convince me to come in, they were saying, oh, this is going to be a baby with 10-inch head, and it's going to be all these problems, but just not basing it off of something they actually saw, just what the hypothetical potential could be. And so I just had to constantly fight that from the beginning of my initial check-in, where when I came in, the chief of the department was the doctor on call, in addition to my actual physician that I had been seeing for my primary care for the baby. And he runs down all of the issues. He says, well, you need to sign a paper that says that in the middle of the night, if something happens and we have to rush you to the hospital, rush you to an emergency C-section, that you're going to authorize for that. But I'm like, is that likely going to happen? Are you just going to do that while I'm sleeping? I mean, like, it was just like this this push, to just make this C-section happen. And I ended up being in the hospital for, was it 4 or 5 days? Was it something like that? And every morning, first thing in the morning, 6 o'clock, are you ready for your C-section? I was able to, through the help of both Dr. Seagraves and Dr. Catherine, just really get in control of the proceedings, if you will. We controlled like how much Pitocin, was used in the induction that, eventually did occur. And, we turned the drip off at a time, we allowed my body to respond to things while everyone just wanted to up, pump it. And it's, as much as there were, again, these moments where there were just some real, I didn't realize in a moment how crazy the things were that were being said, but Rebecca
The epidural,
and Dr.
it's
Catherine
true.
they were like, what did they say to you?
Yeah.
But in retrospect, it really was a constant trying to maintain my sanity and not feel like I'm going to get in trouble for making the wrong decision, right? Just trying to also stick to what I wanted, which was to deliver this child. I mean, I was being told by residents that, my body isn't okay or isn't able to have this child naturally, right? And so, since we all want what's best for the baby, don't you think it's time, to have this C-section? And it was insane.
Yeah. At one point, the epidural, we found out midway it had fentanyl. You were being
Yeah.
told, your baby's heart rate is dropping. Oh, but this, the epidural research, evidence says that there's no effect on the mom or the baby. So that's not that's not causing your baby in distress. But then we had to like actually ask them to remove the epidural and replace it with one that didn't have fentanyl.
Right.
And then your baby was fine.
Yeah. So the morning that was like the 3rd or 4th day that I actually got the epidural. Actually, it was the last day, right, that I actually did the epidural. And I did not ask initially like what was in it. I'm thinking okay, it's pain medications and whatever they use to make everything feel better. And um, at some point, I think it was Dr. Catherine said, we'll ask them what's in it. What does it combine with? And I mean, I almost passed out when he said fentanyl. I had no clue. And so the anesthesiologist was saying that this is what is the best recommendation. It's the best mixture. And I had to ask him at least like 3 times, is there an alternative before he actually said, oh yeah, there is something else we can use. And I mean, I physically felt like the last drops of the fentanyl lace stuff leave, before the new stuff was coming in. I mean, it was very noticeable. So to say that, that there would be no effects on the child, or that the child wouldn't, get any dosages of that, I mean, it's really disingenuous for sure.
Yeah. And so, I mean, Marley, I want to kind of like wrap with Pam's story, with you, that there were, I want to say, at least like 6 different times I thought, okay, if this goes to C-section, the trauma after the fact of the things that were said to Pam to get her to that point, the decisions that she felt was out of her control. And then Pam, you also mentioned, like, on that last day, you could not even afford to really be in the hospital another day because you would be leaving your oldest son without care. So you felt rushed on all sides. So I'm thinking of just like, not even the physical recovery of what a C-section would have meant for you, but the mental impact of how out of control that whole experience felt.
Yeah, Rebecca, that's where my mind has been like this whole time. Like, I'm so overwhelmed for you, Pam. Like, I can't even imagine. And that's exactly what I was going to ask. Like, you said, like, just trying to keep your sanity at that point. And a large part of what I'm, working on too is seeing how can we as OTs incorporate some mental health interventions in the hospital as well. So is like, if there's something that someone could have said to you to like make you feel better, or like, how was your headspace after all of this, if you don't mind sharing?
Well, I definitely recommend women have doulas, number one. I definitely recommend that they have amazing support teams like Dr. Seagraves and Dr. Catherine. Because there was so much I was just able to process with their help. In addition to, I had, a support person, a friend there that was praying the whole time. Okay. I definitely believe in the power of prayer. And there were also nurses who kind of got along with the program too, who were like, I think she's really going to do this. Let me see what I can do now to be helpful. Right. And so there was a couple of nurses who were really just you could tell they were going beyond what was the standard of care. Like the second or third day, it was like a morning I woke up feeling very defeated. And I remember one nurse just said to me, like, well, when's the last time you ate something? Now I had my snack stash of, illegal food items, but because I had the first year experience, for the first time where, I didn't eat for 4 days before they decided to give me the C-section. And I knew that I wasn't going to do that again. But she got me, fresh linen and, a shower curtain so I could actually take a shower. And she said, okay, let's just restart this. Okay. And so I think just the mental health component is, number one, really making it clear that the mom is in control, right? That all of these people who have all of these things to say and all of this experience and all of these recommendations, at the end of the day, they're not in charge. And I think that's like the first thing that needs to be made clear. And that the support team that's there, like really understanding what a team is. And so I think the physical therapist or occupational therapist really could play a good role in explaining that, and being a, not only the occupational asset, but just the advocate, another advocate on the ground that can say, well, I know I just heard the mom say XYZ, right? And so how do we, as a team, as a team of health professionals, help this mom reach the goal that she decided she wanted, right? And that's really what I had, access to with this power team, and I didn't have that on the front end the first time. I mean, I didn't call Dr. Seagraves until after all the drama the first time around, but she was in the thick of it the second time, and it really made all the difference for sure.
So Pam, you're not a healthcare provider. So just last question, would you
No, I'm not.
advocate for an occupational therapist and a physical therapist to be on your birth team during labor and delivery? Like before you give birth?
Yeah, I mean, I think that, especially like I said, in my experience the first time around, like it was very important for me to have some help on like how to maneuver, how not to add stress to my body, in trying to take care of this new life and heal myself. I think certainly the doula played a role in supporting, circulation and movement and all those things, just to help the birth itself um, work well. And just from all of the things that we did talk about, from a birth planning perspective, like I remember when Dr. Catherine said to me, "Girl, you just gonna breathe that baby out, okay?" And I know the first time she said that, I'm like, this lady's crazy, right? But by the time I got to like that point and having all of the information that I had, and it really was a breathing experience, which really made no sense until I was in that position. But now I'm like in awe of what that is, and I actually want to. I'm maybe not, but I might actually would like, if I do have another child, like really try and do it without the epidural, with this knowledge that I know exists. But I think the other thing I just want to say for the record is that I got so much information from this power team of physical therapists, doctor of physical therapy, doula, and I got like zero information from my doctor. So when you look at like the prenatal, care that women get, they're getting like zero information, like none. Like if you don't actually have questions yourself, like very specific things that you're trying to find out when you go into those appointments, you're in and out with nothing that's helping you towards any particular outcome, right? And then when you're in the dramatic moment of labor, it's just so much information. Half of it is in jargon, and it's just not a conducive process. So I think professionals as yourself have that clinical language and the familiarity, but you also have the genuine compassion and care, and you're at a point where you can be providing, that physical and that mental support in a way that just the professionals, the doctors themselves just aren't going to do that. Nurses generally aren't going to do that. Yeah, so definitely important.
Thank you, Pam. Hi, Dr. Bradford. Thank you so much for joining and being willing to share your story. Speak away.
Well, first, I didn't even know that you could control the amount of Pitocin. Like that's news to me. So going into my birth, I've only had one child. He's 10 months, but I wanted to do the natural route. I did not want anything like at all, because to me, I just felt like, why would I want to load myself up with drugs if I haven't even experienced what the actual pain is? And I just kind of like, as an athlete, I could push through this. This is fine. And so when I got there, I ended up having contractions really early, at like, I think it was like 3:30 in the morning. They woke me up. And at first I was just like, that's kind of weird. It feels like a little mild cramp. Went to the bathroom, went back to bed, and then it just kind of wouldn't go away. So then I went back to the bathroom, and then that's when I noticed that my water broke. And I was like, oh, it's happening. So I woke my husband up, and then we went to the Army hospital, which was literally like 5 minutes away. And so they ended up checking me, and they wanted to see how far along I was. And that was the worst experience ever. That was so painful. I did not know when they check your cervix that it was going to be that uncomfortable. When she checked me, she said that I was barely even dilated, like less than the fingertip width. And I was just like, okay. And so immediately, because they said that my water had broken, they were just like, well, so since your water's already broken, you're kind of at risk for an infection, so we're going to recommend Pitocin. And I just literally looked at the doctor, who I had no follow-up visits with, because the main person that I ended up having my follow-up visits with, they kind of just have whoever's on call, that's who's going to deliver your baby at this Army hospital. And so when I met him, I just was like, yeah, no, I don't want anything. Like, I want nothing. I was like, I'm going to push through this. Like, I don't want anything. And so he was like, well, he was trying to like guilt trip me into thinking that I'm basically putting my kid at risk. And so he was like, well, I'll give you like 2 hours and then we'll recheck you to see how far along you are. And then based on how far along you are, we can decide whether we should continue going the natural route without anything, or if we're going to do Pitocin. And I just was like, okay. So 2 hours later go by, and he said, I think I was only like 3 centimeters at that point, which, I mean, I thought that was pretty good going from like nothing to 3. So I just kind of like looked at him and I was just like, do I really have to? And again, he like guilt tripped me into thinking that like something serious could happen if I didn't have my son like ASAP. So then I was like, fine, I'll do the Pitocin. Worst decision ever. Like ever. The pain that I felt with that was awful. Like it was terrible. I was at a point to where I was literally just like in fetal position on my side, holding onto the bed rail and just like breathing because I could not move. And then it got to the point to where some nurse had kept coming into my room. I didn't even know who this nurse was. She came into my room and was like, we can hear you down the hall. Are you sure you don't want anything else? Because you're being kind of loud. And I'm just like, no. So I got angry and I'm like, no, I don't want anything. So then she like left. I don't know how soon it was, but she ended up coming back and was just like, are you sure you don't need anything? Like, this will really help. I got to the point to where I was just fed up, where I was just like, fine, you can inject me with something like the IV meds, but I was like, you will not give me an epidural. Cause I was like, if one thing's going to happen, I'm walking after I have this baby. Like, that was my goal. And so I was like, I don't want to have to wait X amount of hours before it's safe for me to like get up and move. Cause I know that I've just heard horror stories from the epidural. So I was like, I don't want that. So she injected me. I don't remember what it was, but I felt like when I went to like the birthing classes that were at the hospital, I could have sworn they said something along the lines of that if you ended up getting like the IV pain meds, that you wouldn't want to have your child within a certain time frame, because I guess it can put the baby at risk or something. I don't know. But I just know that my son came relatively soon after that, and it got to the point to where his heart rate was at like 260. And so they had to like bring the pediatrician in to make sure that he was okay. And so I'm still in sideline, right? The other nurse, the male nurse who checked me in, he ends up like taking my hand off of the bed rail, grabbed my wrist and told my best friend to hold my wrist and pull me into supine. And like they forced me into supine, and I literally did not want to be in supine, because knowing being a PT, like I know that being in supine is not the best position. And I was just like, I don't want tail pain, like tailbone pain. But obviously in that mindset, I'm just like, I felt like I couldn't control anything. So she felt awkward. She's just holding me and trying to like soothe me and say, it's okay, you got this, like being the very good like support team. So then they end up yelling at me to push. So I'm just like, and in my head, of course, my PT brain isn't working because I'm just like, I'm not supposed to push. You're not even supposed to push when you poop. Why would I push when I'm having a baby? Like, you should be using different words, like, with the breathing techniques. Obviously, I know this now after taking like level 1 Herman and Wallace, but still, in the moment, I just was like, whatever, let me just get this over with. Had my son, he ended up being okay. But then the doctor said I had like a grade 2 tear. So he was like, we got to stitch you up. And I was like, okay. So after I delivered the placenta, yada, yada, he ends up injecting me with something. And I'm not even kidding. Like, he injects me with the numbing agent and immediately starts stitching me, like, didn't even wait. And so I felt every single piece of it, like every little bit. Sorry. I'm I've never felt so like not in control like ever in my whole life, and that felt terrible. I was like shaking um to the point where every time he would stitch, my best friend was like looking at me, and she was just like, she was the one who actually told him to stop, because she's like, can you stop? Like, can't you see that she's in pain? Like, she's not being a sissy about this. Then I overhear him complain to the nurse and said, I already gave her 19 units. And I just wanted to be like, really? Like, you literally injected me and immediately started stitching. Like, you didn't even wait. And then on top of that, pain is relative. Like, everybody's pain tolerance is different. Two, I don't know what 19 units does for somebody else, but I'm taller than the average woman. Like, I'm 6'1". Like, sir, I'm taller than you. So in that moment, I just felt like I just wasn't heard like the whole time. So that was pretty terrible. But then he finally gave me more, and he actually waited a little bit, and then he stitched me, and then I didn't feel anything. But that was like, that was probably the worst part of the whole experience, was just not being heard. And the annoying part of it was that the hospital, whenever I was having like my prenatal follow-ups, they always kept harping on like, you can have your plan. Like, we want to listen to you. We will follow your plan. This man didn't follow my plan. He wanted to basically just hurry up and go home, essentially, which was really upsetting because he was actually in the pregnancy 101 classes because his wife was also pregnant. She was only like due, I think, like 3 weeks after me. So I just like, it's just almost as if, like, would you do this to your wife? Is really what I wanted to say. But obviously in that moment, I'm not there. I'm just trying to like try to stay positive because I'm like, okay, at least my son's fine. I'm alive. He's alive. Just because I know, like, the mortality rate with like women of color is pretty terrible. So I'm just like, I'm alive. He's alive. It's okay. But yeah, it was rough. And if I could go back, one, I would have a doula. Two, I probably wouldn't do it at a hospital. Probably would do it at a birthing center. But yeah, so it was pretty rough.
Oh, Dr. Bradford, Marley, I'm so sorry. There were so many emotions. Just
Yeah.
hearing that. Thank you so much for sharing.
No problem.
That 10 months ago, that's
fresh.
so fresh.
That's raw. First of all, thank you so much for sharing that. And I can't even, my heart broke for you, like just hearing that, and you and Pamela, like, it's just horrible. But I appreciate women like you for being so willing and brave to share these things, because it's going to change the trajectory. That's why we're all here, So the main thing that I'm hearing from you and her is maybe there's a role for us during the labor process too, to be the advocate, to give you the techniques and like you said, you're a pelvic floor therapist. Like, you advocated for yourself. You didn't want to lay on your back. Like, you knew the things to do, but still, like, there still needs to just be someone there to be there specifically for you on your team when those who are supposed to be your professional medical professionals are not there for you. Oh my gosh.
Dr. Bradford, may I ask you, why Why did you want to share your story?
Just because, I don't know, I guess being on here, because I'm assuming that most people here are healthcare professionals, to hear another healthcare professional kind of go through it, and it's like, maybe it'll motivate people to really get the ERAD program like started in everyone's hospitals, which is why I purchased it and why I want to start it at this hospital, because I wouldn't want any woman to go through what I went through. So yeah, it's just to, like, I guess kind of forward to just let people know that this isn't okay. I even like talked about it with my current coworkers, and I'm the only minority on the team, but to hear two of my coworkers who are, they're white, but I think they come from lower income, when they told me their stories, like their birth stories were also traumatic. So to me, I'm just kind of like, okay, there's clearly like, there's a gap. It's a big gap. And I just feel like maternal health as a whole, there's really not, it's like non-existent. So I guess I just wanted to share, just so that people are more motivated to really want to get to make a difference. I mean, obviously we want to since we're here, but you know.
Yeah. Dr. Bradford and Marley, you know this. I didn't design the ERAD program to help women during labor and delivery. And I think that is a problem. Because Dr. Bradford, when you start this program in your hospital, and Marley, when you start this program in your hospital, do you kind of feel like people should have you on their team?
I feel like there's a benefit to it. And I feel that at least that these women should have the option. To me, I'm like, okay, if we have all these options for how we want to have our births, they should also have the option and even know that it's even there to have a PT and an OT. I also feel that when it comes to just the prenatal stuff, I feel that not enough women even know how to fully prep for it. And if they do prep for it, like, I don't know if they get that PT aspect of it to see how a PT really can help you. So I think that if someone was doing like prenatal classes or exercises or prep with a PT, then they probably would see the benefit of having the PT right then and there while they're having the baby, or at least be like, where's my PT as soon as the baby's out. But I think there's a big benefit to having them right then and there. It's just more so, I guess my only thing is I don't know if the hospital would really want us to be there, or if they would see a need for us to be there. That's the only downfall.
Sure. I will say the ERAD program was not made for the hospital.
Yeah, nice.
So I didn't have it in mind of what to do to please the hospital. But now I do know from your story how an OT and a PT could be more involved before that ever happens to anyone else. Thank you so much for sharing.
No problem.
Yeah, thank you so much. I appreciate you so much and everything that you've been through.
Thank you.
Yes, and thank you for sharing your story.
Of course. I want to say that I'm so happy to hear everyone else's story that came before me. And sadly, I can relate to a lot of what they went through. I'm sure a lot of people on this call have had births which is unfortunate. But to get into my story, I have 3 births. So I'm not going to get into the nitty-gritty details, but suffice it to say that I can relate to a lot of what we've heard earlier tonight. But I do have a couple points that I want to talk about. So my first pregnancy was unexpected, but welcome. And it wound up ending in a stillbirth at 18 weeks. Technically stillbirth isn't until 20 weeks, but for me, I think that miscarriage doesn't quite cover what happened. So I had a baby with Turner syndrome. We lost her at 18 weeks, and I didn't have any physical symptoms after the birth. I recovered physically okay, but I do want to say that now that I'm in the women's health space, I have seen that people who are dealing with perinatal loss do have needs after, during pregnancy and after birth. And so I think it's really important that we consider that and be sure that we know how to use language and have handouts for people who have gone through birth but don't have a baby afterwards, right? That's really important for us to be aware of because it may be rare, but it's definitely important. But so that's how my journey with motherhood started. And then after that, I got pregnant again about 2 months later and wanted a natural birth, wanted to, go through without an epidural and just have a healthy baby. That was the goal. But because of the trauma of having a stillbirth, I couldn't bring myself to prepare for birth because I thought, I know how this could end. And if I put all this time and effort into preparing, and I wind up, in the same situation, it would be even more devastating. So I didn't prepare physically, emotionally, I don't think. And what wound up happening is I had something very similar to what Dr. Bradford described. I had an OP baby, so occiput posterior or sunny side up. It took forever to push him out. It was very, very difficult. I had an epidural that didn't work, so I could feel everything, and wound up with an episiotomy and being stitched up before the lidocaine had taken effect. I had a grade 3 tear, and but I had a healthy baby boy. So at the end of it, I was like, okay, we've got a healthy baby. I'm healthy. I was happy with that, but I knew going forward that I didn't want to have that kind of experience again because it was very traumatic. My blood pressure was through the roof. My temperature was through the roof. I was on a non-rebreather mask for oxygen. It was not a pleasant and peaceful experience. And after that experience, my OB, who was okay, I mean, she gave me an episiotomy, which I wasn't a fan of. But I was in a space where I could focus on my physical recovery because mentally I was in a better place than my first birth. But I wound up having some pain with sex after, about 8 weeks. And I went to my OB and told her, and as a PT, I didn't do pelvic health at that time, but as a PT, I said, I think I need a pelvic health PT referral. And she said, no, you just need this, topical estrogen. You're fine. And she prescribed that. And I remember thinking like, I should probably advocate for myself a little bit more, but my son was breastfeeding only at night, and we weren't getting any sleep, and I was about to go back to work. So I decided not to pursue it any further. And it was kind of like a Band-Aid that worked for a little bit, but then I got pregnant with my daughter about 4 years later. And by that point, I really prepared for birth. I did hypnobirthing. I did spinning babies. I did all of the things that I needed to do to avoid the situation that I had with my son. And, by that time, enough time had passed that I felt like I could really kind of go all in with preparing for this birth experience. So that's the one good thing I'll say about having a traumatic birth experience is if you get another chance to do it, you can change things and hopefully find a team that will support you in that. So I was able to do that. And I was really fortunate to have just the most amazing experience. It was not a natural birth. I did have an epidural, but it worked. And it was kind of like a walking epidural. So I was able to move and adjust my pelvis and that sort of thing. And my daughter came out, and I felt in control the whole time. So I wound up getting an epidural when I didn't want one. I did have to be induced because of hypertension, but I still felt like I had a say in all of the steps. And that made it such a positive experience. So knowing that I had prepared and was able to give my input was really important to me. The unfortunate thing about that birth is that about an hour after my daughter was born, she had to be transferred to the NICU. So, and I had another 3rd-degree tear, right? In the exact same spot where my first one was, which I think could be a result of the fact that I didn't go to PT. I didn't work on as much tissue mobility as I could have. I had this scar that essentially just ripped open again. And this time it was a lot more painful. And again, I wanted to get pelvic PT, but I had a baby in the NICU, and I couldn't focus on that. And then, this is one of the things that started me on this course of like wanting to help NICU mamas, because I would have loved and it would have benefited so much from having someone come to me while I was in the hospital and say, like, what can we help you with? Because I did not have the bandwidth to go to someone for my issues. I was way too focused on that NICU experience. And so that was, an unfortunate part of that recovery. And that wound up, I think, resulting in me taking a lot longer to recover from that grade 3 tear. So that's my story. I just wanted to share, there's a lot in there, but just want to share that, like, take care of your mamas with perinatal loss and kind of think about what they've been through, and then take care of your NICU mamas because they need it and they can't always come to you. So you got to go to them sometimes.
And just based on your second experience, given that, you it actually was based a lot of from your first experience from having perinatal loss. But I want to ask Marley a question. If someone, if you were aware of a patient who, in this case, yes, Dr. Lejeune is a healthcare provider, but in that moment, we're not healthcare providers. Can we all agree, right? After what we just heard today. Okay. So she didn't prepare for her second birth, right? Because of perinatal loss. There was trauma associated with that. And then Marley, she described a horrendous experience of having a non-rebreather mask, of having a third degree tear, just really not being able to be fully functional right away. There's so much chatter in terms of what an OT would do, what a PT would do. Do we need both? Do we need both disciplines? And to me, I'm like, all you have to do is genuinely hear someone's situation. And in that moment, I think the best thing would be is to just walk into the room and offer.
You read my mind. That's exactly where I was going to. So for those that don't know, in occupational therapy, we have two of our domains of practice are education and advocacy, and we're also trained in mental health as well. So physical health interventions, mental health interventions. And when you have patients like that are in such an acute physical and mental traumatic state, there's just, and I owe a lot of this to soon to be Dr. Kaylee Nolan, who's on here. She was my mentor as a student while I was at the hospital that I currently work at now. And I have no problem at all doing an entire session of just talking to someone through what they've been through. How can I use my therapeutic use of self to make you feel better in this moment, which was something that Kaylee taught me as a student and that I've carried on into my practice now. What can I do for you to make you feel better in this moment, tomorrow, and through your postpartum recovery? Is it just talking? Is it crying? Do we journal? Do we work on breathing techniques? Anything that can help your state of mind feel better after everything you've been through. Because until your brain and our body are, two synchronized ships. If one's off the other, we got to get that brain and those emotions and those coping skills. Those are just as important as our physical recovery as well. And I think having an OT, maybe we don't do as many of the physical interventions, but having someone on your team to say, what happened to you and how can I help to make you feel better? Because that's what I'm here to do.
You said you had a third degree tear in the same exact spot and it was just as painful, and you had a baby in the NICU. And I mean, this is just from my hospital experience. We didn't have the same seating options that we did on the maternity floor for the NICU, for moms that were in the NICU. We had hard, uncomfortable chairs. That was just our particular hospital. Every hospital is different. But in your case, would you have found value just in that, like not knowing who's in the room, just knowing there's someone to help you? Would you have found value in someone taking into account your baby's in the NICU, you have a 3rd-degree tear, what can we do to help?
Absolutely. Because we know, I'm a NICU and women's health therapist. So we know that the more time that mom can spend with her baby, doing skin to skin, participating in feeding, just physically being present is helpful for baby and for mom, for both of their journeys and recoveries. And when you're in the NICU and you're recovering physically and have any issues, you're going to limit your time, because I could only sit. It was the same thing. We had those rocking chairs with like, a paper thin pad on it. I could only sit for about 30 minutes before I would be in so much pain that I was like, I have to go. And at the time I did not do pelvic health. And even if I did, I don't think I would have been in the mental space to like implement those interventions myself. So had I had PT or OT come in and give me some tips, I would have been able to hang out for a little bit longer and be with my baby more, which would have benefited everyone. So it's really important that we are addressing something as simple as what chair they're sitting in. It can make a world of difference.
Right. Is this a PT thing? Is this an OT thing? I don't spend a lot of time in those conversations, because all I can hear from this conversation, Dr. Lejeune, is your story. And I think that there's room for everyone if their intention is to help your experience improve from where it is currently. I think that there's room for everyone. It's almost like it's a conversation between, well, if an OB nurse has training with lactation, do we really need a lactation consultant? Or do we need, a doula if the nurse is going to be there? I mean, it gets down to kind of nitty gritty, and then we're losing focus on this person who needs all the support that we can possibly give. And it's not really up to us to decide for you. I think it would be appreciated from what you just described. And thank you so much for sharing.
Of course.
You're welcome. So yes, I am an occupational therapist. I'm very new in the women's health arena, but I've been practicing for 2 years now. So it's one of my passion interest areas, and I'm really starting to kind of dive deep into it. So I would definitely appreciate any recommendations on courses and things. That would be great for my development. But I did want to speak on my own birthing experience as well, because much like everyone else, I have pretty similar traumatic issues with what had occurred with my own birth, especially as a first-time mom. So I just had my first son Christmas Eve of last year. So I feel like what Pam had touched on earlier about you're not getting information from anyone really, and unless you have questions. I feel like unless I had a question at my OB appointment, it was like 15 minutes. I waited an hour. We were in there for 15 minutes and that was it. No questions, send you on your way. I've got a lot of back and hip issues already. So I knew of pelvic floor therapy, and I asked my OB for a referral, and she was really great about it. She got me a referral, and my chiropractor was the one who referred me to her pelvic floor PT. So I was fortunate that I knew and had at least that understanding that that was something out there available for me. And honestly, I feel like that was something that I was so valuable, and I was only able to do just a few sessions of the pelvic floor PT just for it's so expensive. And I don't think I realized just how little insurance is willing to cover such a vital resource, especially for new moms or pregnant moms that are about to birth, because she really helped me. I mean, I would have had no idea about those breathing techniques going into labor. And that made a huge difference because I had, I think my labor was like 22 hours in total, but when I had got there, I was supposed to be induced a week after, but he decided to come early, as they like to do. And so my water broke and I went to the hospital, and it was I was already dilated a little bit, and so they wanted to like let me keep trying to progress. I did not. I went in first time mom thinking, again, I want to try this natural. I had no reference point for what contractions were like. And boy, that was a wake up call once the pain really started kicking in with those. And but I still really wanted to try to do it natural. So I pushed as much as I could. And the first nurse that I had, she just seemed very uninterested and wasn't very helpful. I had asked for a peanut, like the peanut ball. I wanted something that I could utilize. I wanted to be on a ball, something that I could move around, and she never brought one. I like asked 3 times. I never got one. I wasn't able to get up and move around because they put the internal monitoring system on me. So they weren't letting me get up and move really out of bed. And I mean, with our knowledge of the body mechanics and the importance of that, and with my pelvic floor information from my therapist, I was like, I really want to be moving. I know that's good for my body and know it's going to get things moving. And it just wasn't. I didn't feel heard. I felt very much not in control of any of that. And then they finally let me go for like one walk with my husband in the hallway. And then the pain really started kicking in. So I just felt like I wasn't being listened to, and I couldn't get up and move. And then finally, when I was allowed, they were like, well, nope, the pain is getting too advanced. You're not going to be allowed to kind of keep mobilizing anymore. And that I felt like they kept pushing the epidural. Well, do you want the epidural now? Do you want the epidural now? And I really didn't initially even want one. I was very nervous. I had read up about the side effects as well. And I was like, oh my gosh, I don't want this to be a problem. But finally I was like, I just felt like it was poking and prodding. So I was like, okay, let's just see. And like, I'm in a lot of pain. Let me just give it a try. It hurts too much. Let's go ahead and do it. And I felt when the nurse anesthetist came in, again, it was Christmas. It was December 23rd at that point. So we were moving into Christmas Eve. So I felt like she was very much not interested. Like she didn't introduce herself to me. She didn't talk to me. She didn't even come and like speak to me and look at me before she just started going to my back, having him move to where he had to be in the sterile area, and then just kept moving. Like she got getting irritated when I would move a little bit because of obviously the pain. And you want to be still, but it's painful. It's not an easy process to get one of those. And so she gave the epidural, and I was still having a lot of pain, like significant amount of pain. And I thought it was starting to work, and it ended up only working on half of my body. So one side was not feeling anything, and the other side it almost felt like it was triple the pain of what it was before. Like it was so terrible. So then I felt like I couldn't move. I couldn't get comfortable. It was I have never experienced a pain like that in my life. Truly, I have not. And I didn't feel like I didn't feel supported. I didn't feel like I had much of an issue, other than they kept coming in and wanting me to do the different circuits. And it didn't matter how much pain those positions caused me. They wanted me to do them because if I don't do them, then the baby's head's not going to rotate and I'm not going to be able to push them out. So you have to just keep doing it, even though it was causing just significant amount of pain and anguish for me. So that was really difficult. And much like, Kashia I think that's not her name that spoke earlier, just 2 persons ago. She had mentioned the Pitocin thing. I didn't know that either. I did not know you could control your Pitocin, because I felt like they just kept upping it. As soon as they gave me the epidural, they started the Pitocin, and I just felt like it was rushed. Like every time they would check me, which those cervix checks were really intrusive and really painful. And I felt very much very vulnerable already. And you can't control that type of thing. and they would just up the Pitocin. Every time it wasn't a number they wanted, they just kept upping it and upping it and upping it. And it was just, again, only half the side worked. So it was just in making the pain so much more intense. And they tried to redo the epidural, and it still didn't. It helped a little bit, but I was still having that pain. And so it was just, I just felt very helpless. And I wanted to be in sideline. I couldn't be on sideline. They wanted me to be on my back. They put me in that frog position and said, you have to sit here for a while. And I'm like, I just can't, I literally can't. And at one point in time, I kept telling the nurse, my body is telling me I need to push. Like I cannot keep it from pushing anymore. And at one point it was pushing without me telling, like it was just going, like my body was ready to have the baby. And the nurses kept telling me, you cannot, like, do not push, like you're not ready. And I'm like, I can't keep myself from doing this. So it was miserable, absolutely miserable. Then the nurse finally came in, and my doctor wasn't even there. Like it was an on-call doc. They had left the hospital after doing a cesarean and they weren't there. So they kept trying to ask me and say, well, are we going to wait for the doctor to get there? And I just kept saying, I cannot wait. Like he is coming right now and I need to push. And they were not very great about coaching me on the breathing or anything. So I'm happy that I really had that information, because that really, really helped me. Otherwise, I wouldn't have known what to do. My body did it for itself anyways, but I just would not have known how to even get through that process. And as a first-time mom, I just didn't know that I had those options. I didn't know that I could have a say in what was going on. It felt very much like I was having things done to me and I wasn't being collaborated with. And I think especially in OTs, we collaborate so much, especially with our PT counterparts, that piece of communication is so important to us. And I just felt very much left out of the whole process. And I mean, at the end of the day, he was healthy and we were okay. And I was okay. And that was the biggest thing. But afterwards, when you're thinking back on all that stuff, it's like, I just didn't feel like I had the support from the healthcare professionals. I didn't feel like they were giving me the information I needed or would have benefited from. And it just felt so rushed to get to the end point, because it was Christmas Eve and people wanted to be somewhere else that was not there. So that really kind of sucked. But at the end of it, I have a beautiful baby boy, and that's wonderful. So if I could change something, or if I could go back, or for my next child, I think the PTOT services are absolutely vital in the care team, as well as the doulas and the pelvic floor before, to prep you for birth, is so important. I wish that was something that was more readily available for people, especially with the insurance coverage. It's unfortunate that it's an expensive service, because I feel like if it wouldn't have been so expensive, I would have for sure utilized it a lot more than I even was able to utilize it. So that's my little spiel.
And you're 8 months out, is that right?
Just about, yeah.
Almost, right? At the end of
Yes.
this month, you'll be 8 months.
Yes.
It's still very fresh.
Yes.
If you're not, let's just kind of pull you out of the healthcare care provider hat, because in that moment, you didn't feel like
I didn't have it. No.
Right. If an OT would have walked into the room, like after all of that, we're now kind of, I think, all on the same page, as we could probably be used a lot sooner.
Mm-hmm.
But if it were after the fact, what would you have loved for someone to just kind of walk you through?
I mean, it's a new role, like altogether. You're healing from something. So how am I going to take care of myself, and how am I also going to step in this new role as a mother and take care of my child, as well as take care of myself, as well as take care of my mental health? I just don't feel like I had a lot a lot of options or assistance with that. And I think that was something that was really missing. And I think in OT, I focus a lot, like Marley, I focus a lot on the mental health components with my patients, especially in acute care settings. And I didn't get that. And I think we would really be able to provide that assistance in an area that I think there's a gap missing, because I don't feel like even in the postpartum area, it was just, here's all this information we need to give you. I'm just going to rattle all this off. Here's all this paperwork. You don't really need a lactation because he's latching. So we're not even going to do that. And like, I felt really like let down for those things, because it wasn't great. But I think there's a gap, and I think we would be able to really step in and fill that role, especially when we're discovering those new roles for ourselves. Because I'm not thinking in terms of being a therapist. Like, I wasn't in that mindset at all.
Do you think it was decided for you that you didn't need an OT or a PT?
Oh, very, very much so. I wasn't even offered the services because I didn't have any physical like limitations. I could get up and walk to the bathroom, so I didn't need any services. It wasn't even something brought to the table, honestly.
Can't see mental health, right, Marley?
Yeah, absolutely. I'm just like in shock, because I'm wondering how frequently these stories are happening and we're just not talking about it, because we as women, and I am not a mother myself, but mothers are just expected to just get up and go, carry on, and business as normal after this life-changing event, which sounds like is becoming more and more traumatic and complicated by the day. And to have to deal with all of that, and even the service teams that are coming in and maybe doing their best, but I feel like there just needs to be a change, a shift to promote functional recovery, both physical and mental. Your vitals are fine. You can walk to the bathroom. Great. But how do you feel? How are you dealing with half of your body only being numb after labor? Like, how does that feel now that you're reflecting on that? And how do you feel as a first time mom? And what is your headspace like? And like you just said, I think having someone coming in there and just like talking you through that, introducing ourselves, getting a friendly face in there and just saying, what can I do to help you? And even if you are too overwhelmed to even like have a full conversation about that, here's a list of references of who you can contact afterwards when you have time, or just the energy to just say, okay, now I'm feeling a certain way. Things aren't working the way that I thought they would. Here's these handouts or these references that I can look at now that I'm home in my space and a little bit more comfortable. But I just think there needs to be like a systematic shift all the way around.
I agree.
Thank you for sharing.
You're welcome.
Thank you.
The opportunities that I have been able to get and apply to my own life has also allowed me to share that with my patients. And I think it has to be on a, provider to provider like situation if you're willing to share those experiences with your patients. But I have found that it helps. I was very, very fortunate to have my first baby in a baby friendly hospital with a certified nurse midwife. I experienced birth and that my water breaks. And then I have basically Braxton Hicks. My uterus never has good efficient contractions. And so my midwife let me stay home and walk and go for 12 hours before they wanted me to come in. And I never had a single cervical check during that until I was in active labor, which took approximately 40 hours. They let me go and do it on my own because they were monitoring baby and she was doing okay. And I was fine. I don't remember if I had an IV at that point with her, but about 36 hours in or so, I did decide to get an epidural because of my fatigue. I was so tired. I had not slept since my water broke at midnight the night before. And so I ended up with an epidural, which I, despite being a previous acute care therapist, forgot about the button, did not even realize that I could add more medication if I needed to. So then I was in active labor and the pain was excruciating. I was again very fortunate. The anesthesiologist stayed at the hospital after he placed my epidural, even though it was a Saturday during football season. And he came and gave me a bolus, and I was totally numb. Now, for me, that benefited me only in that I did not have severe tearing. I did have a grade 2 tear. But with my fitness level and my absolutely zero women's health knowledge at that time, I got lucky with a grade 2 tear and a healthy baby, and I get to watch her being born and all of that thing. So that like lit my fire. And while I was pregnant with my second son, I took OBI with the Academy for Pelvic Health. And I think right now it's only open to PTs, which is kind of unfortunate. Maybe they'll change that. But it's the intrapartum. It's where we as physical therapists can add to the birth experience. It like opened my eyes to so much. I had already completed several pelvic health classes. I was treating pelvic patients. I was a couple, 2-3 years into treating pelvic patients and pregnant patients. And just everything it's so good. I highly recommend that class, even if you're not interested in doing the certifications or any of that. I do have all of my certifications are done with CAP, except for I haven't done my case report yet, but that's another story. But when I went into labor with my son, again, I woke up and my water broke and I knew nothing was going to happen. And I had a fairly good relationship with my OBs. I was in a different hospital now. It was a more traditional hospital. I had OB care. And I called I take that back, one step back. I went to my 39-week on Friday, and the OB I saw was a good friend of mine. And he said, "Do you want a cervical check?" And I said, "Why?" And, I said to him, I said, "What is your professional opinion on whether or not that's even effective?" Second child right here. And he said, "It's really just curiosity." So I felt really good about that. And I tell all my patients that you can refuse a cervical check at the OB's office. If you don't care, they don't care. So then when I went in on Sunday and they asked me what my dilation was on Friday, I was like, well, but she was fine. I went in and I had them start Pitocin straight away, but it was I was in charge. I knew what I wanted. I told them, if I end up with the epidural, I want towel rolls so that my sacrum can float. I want, I want to move as much as I can. I want, whatever. And I did feel supported until it came time to push. Now, I put the towel rolls and I did end up having an epidural at the end. I was about 8 centimeters, which means it didn't take in effect too much, but it did help my abdominal pain. And so I had my towel rolls. So my sacrum was floating, even though I was on my back, and they were yelling at me to hold my breath and push. And I was like, if I hadn't been about to push that kid out of me, there would have been a conversation. I was furious. We don't hold our breath and push. It's not effective. It has been shown to cause, contraction of the pelvic floor muscles. And so I just kind of didn't and would like fake it. And then they would yell at me some more. And in any case, he came out about 3-4 pushes. He was gray. Apparently he had a really tight nuchal cord. He's fine. His FGARs were 9 and 10. He's going to be 4 next Friday. And he would tell you he's just fine. He's just bothering me right now. But this is a bunch of pelvic PTs. I'm telling them about your story. But I did go to my follow-up with my OB, not the delivering OB, another OB, when we only have 4. And I said, "Why are you telling people the purple push?" And he said, "Well, they don't know how to push, Megan. They just don't know how to push." And I said, "Then you send them to me first, and I will teach them how to push." And so we were really starting the process of getting a prenatal class going and it being more of a musculoskeletal thing. And this is what's normal. This is what your body's going to go through. This is not normal. This is how you practice push. This is how you prepare for childbirth, blah, blah, blah. And then, of course, COVID hit. So everything's kind of slowed down and we're still working on getting that going. That provider has since retired, yada, yada. And I know I posted on the group, Rebecca, about going to my hospital. I work in outpatient physical therapy, private practice. I'm not associated with my hospital, which is kind of one of those hoity-toity, you don't work here, you can't come here, we're not going to let you observe surgeries or do anything. So we're figuring out the back way of getting in there. Luckily, our OBs are separate as well. But for me, that OBI class taught me all these things. I actually was able to keep my therapist cap on in the right way while I was in labor with him. And I had grade 1 tearing with him. He had a 15.5-inch head, which adds up to 12 centimeters of dilation. And I did measure that. The nurse had to measure his head 2 or 3 times. He's normal now, but but it went to show that, they didn't know what they were doing. I knew what I was doing. And thank God for that, because otherwise it could have been a different story.
Megan, with that OBI class, did you also have prenatal training as well? Any like birth prep or anything like that?
I took, with my first pregnancy, I took like a baby class and a breastfeeding class. With my second, I know how to do this. And I didn't, and I hadn't taken the other 2 OB classes yet. But I felt fairly confident. I did hypnobabies with my first. I did mindful labor with this one. I have I used to have the book. I loaned it to a patient. Now it's gone forever. But I used my breath a lot. Yes, just a minute, baby. And that made a huge difference. The prep wise, I didn't go to their class the second time because I did not find it really that helpful. The only reason I really liked the class with the first one is because I got to tour the hospital and see where I was at and see which room had the tub, so I could go to the tub if I wanted to. And so,
wow. Just to end with this, if you can, if you're able to take your clinician hat off, what would you have liked before after the first or the second birth? What would you have liked an OT or a PT to ask you after you delivered?
If I honestly, if I hadn't had my PT hat on after my first, I was completely numb because of that bolus. And they wanted me to try to void before we went to the recovery room. And I said, my legs aren't working. Well, do you want a bedpan? I said, have you ever tried to pee in a bedpan? No. If you bring me a wheelchair, can I try to go to the toilet? And she brought me a wheelchair, but those 2 nurses stood there and did nothing. They didn't know how to act around that wheelchair. I'm the one who pulled it closer to myself, set the brakes, took the leg rest off, moved the armrest, did a scoot transfer, wheeled myself in, did the stand pivot. But all of that would be for naught if I hadn't been an acute care PT in a past life. And that's where that OTPT should almost always come in. Just a minute, buddy. They don't know that stuff. When I worked in acute care, I worked at a level 1 trauma center in Omaha, Nebraska, and I worked on med surg. And do you know how many colies I had to teach how to get out of bed with an incision this big? And yet, no, I saw one pregnant person my entire time there, and it was because she fell down the stairs and broke her femur. And they did a cesarean and an ORIF in the same surgery. And so I got called to her because I was the orthopedic med surg PT. And, I remember I was a baby PT too. So I think I'd been practicing a year. And I remember being like, how are you going to do this? OT didn't go, just I went. I showed her how to use the walker, and thank God her mom was there to take care of all the other stuff. But if she'd been going home by herself and I've been a provider now for 13 years and I have way less of a filter now. And so I'm not as nice about those sorts of things as I was. But, I have had patients recently. I had a patient just a few years ago who was a woman of color. So that already started me off mad about her experience because I live in very rural Nebraska. She had a pubic symphysis separation. She had an MRI to see why her leg was numb. She had pudendal neuralgia, all of this. And she went home on crutches. This is number one. She went home on crutches, and I got a referral a month later. She was still non-weight bearing on that leg. I put her in a Sorolla belt on the first day. She had just a random gait training PT come show her how to use the crutches, and then they left. And so having that extra bit, even if it's just, a luncheon with acute care staff, like, hey, if you are like, I don't know, then you call us. That's why we're here. That's why that we exist. We need to be able to help these people go home better, not go home in pain, and not go home not walking. And this woman had a toddler at home, and it's just, oh my gosh, I got so mad. So I get fired up about all of this for sure.
Megan, thank you so much for sharing your story. Marley, anything to add?
Yeah, I mean, you kind of like hit the nail on the head, especially like with the acute care side, which is kind of what sparked a lot of this for me. We are routinely consulted for people like coli patients, gallbladder, appendix, knee replacements. And yes, it is important and we are needed. But why are we not seeing the women who are also getting their stomachs cut open and then handed a newborn and not teaching them how to handle themselves and their baby? It is just mind-blowing to me. And I'm not a mother, and it never just like occurred to me. Again, I feel like this standard of just like have your baby and get up and go. God forbid you have a complication like a pubic symphysis or anything like that, and just good luck. Best of luck to you. Hope it feels better soon. So yeah, that right there in the nutshell is my whole reason for wanting to do this. There just needs to be such a change in our standard of care, in our protocols, that every patient in the hospital, there's a whole unit right now that's not being routinely served by us. And it's sad. It's sad.
100% agree. Megan, thank you so much. Thank you so much for sharing your story and for getting in this fight. Really feels like a fight.
It does feel like a fight. I know that to give everyone else that boost, I've had several patients lately go in for their second birth, saw me postpartum outpatient, and then went and had significantly shorter second stage labor with a much better outcome with a vaginal birth. And I mean, that's what you need to get. That's the good feeling that tells you why we're here.
Absolutely. Thank you. Marley, yeah, I hope we have enough fuel to kind of run this mission that you're on. I really do. I'm thankful for everyone who shared your story tonight. I'm fired up, and I'm like surprised at how well I've been able to contain myself. And hopefully this really does serve a greater purpose. But Marley, if I can support you in any way.
Again, just thank you so much for this course, and your support has been just such a blessing for me. It is not lost on me that I think, I was kind of led to do this, and it's given me so much knowledge and excitement and just passion and, what I want to do and how I want to spend my career in this field. So thank you again. I can't tell you how much I appreciate it.
Awesome. You're so very welcome. Have a good night, everyone.